This is Socrates Aristoteles. He's a 65-year-old librarian working full-time at Curtin University and came to talk with us about his concerns of his lower back. Upon discussing the nature of his concerns, we realised the true source of his lower back pain came from daily activities at work. We joined Socrates at Curtin University Library to further investigate and analyse his movements during his performance of daily work activities. After observations made in his working environment, it is clear one of Socrates' source of back pain problems was due to his technique in retrieving books. When moving his body down towards the books, his hips move in the sagittal plane on the coronal axis to create a flexion where the angle of his hip joint decreases. The hip flexors in his body within the iliac region perform this movement. These are the psoas minor, which stabilizes the hip, psoas major that performs hip and trunk flexion, and iliacus, which also does hip flexion and stabilizes the hip. The posterior aspect of the upper thigh, the hamstring, extends when the hip flexes. These muscles are, starting laterally, biceps femoris, semitendinosus, and semimembranosus, which all cohesively perform hip extension. To maintain a straight leg, the knee is extended superiorly by the quadriceps, the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. These muscles all work bilaterally to create this movement.
The hand consists of many muscles and joints which assist Socrates with the action of grasping objects. The flexor pollicis brevis is a superficial muscle of the hand. It acts on the thumb, flexing it at the metacarpophalangeal and carpometacarpal joints, and producing medial rotation of the thumb, allowing us to manipulate objects, like Socrates does when grasping the books. The flexor pollicis brevis, along with the flexor pollicis longus, acts on digits 2 to 4, flexing them at the carpometacarpal joints. The flexor pollicis longus is a deep muscle located in the anterior forearm. The opponens pollicis is in the middle layer of muscles located in the hand. Its function is to oppose the thumb and assist in grasping objects. The flexor digitorum profundus, a muscle located in the forearm, also assists when flexing digits 2 to 4 at the metacarpophalangeal and interphalangeal joints.
The vertebral column consists of 33 vertebrae, which are separated by intervertebral disc. Main functions of vertebral columns include protection, support, axis, and movements. To move the vertebral column, bilateral contraction of erector spinae will be needed. The erector spinae muscles comprises the intermediate layer of the deep muscles of the back. They are on either side of the vertebral column, between the base of the cranium superiorly and pelvis inferiorly. It is divided into 3 groups, from medial to lateral, which is spinalis muscles, longissimus muscles, and iliocostalis muscles. Transversal spinalis groups lie deep on the back muscles, and it is between transverse processes and spinous processes. The groups are semispinalis capitis and cervicis, rotatorus longus and brevis, as well as multifidus. Additionally, as occupational therapists, our aim is to change the environment to assist the individual. By utilizing the trolley, Socrates minimizes the weight bearing of the books which he used to carry on his arm. That way, it relieves the pressure on his vertebral column as well as his erector spinae and the transversal spinalis groups.
When Socrates incorporates a squat to reduce the impact of retrieving a fallen book, he further relieves the pressure in his lower back, initiating several leg muscle groups. These are the quadriceps, hip flexors, gluteals, and hamstrings. Together, they contract concentrically and eccentrically, whilst flexion of the knee and hip is occurring. Inferior to these muscles, the gastrocnemius holds stability in the knee, whilst the leg contracts within the sagittal plane.
When Socrates places the books on an empty shelf before picking up a single book and placing it on the top shelf, he is able to relieve some pressure from his lower back by carrying a lighter load. Socrates engages many muscles in his upper arms, such as the pectoralis major, coracobrachialis, and the anterior deltoid, to extend the humerus at the glenohumeral joint so he is able to place the books on the top shelf. But this extension of the arm does not relieve his lower back pain. It is more that he is carrying less books, which removes the strain on his lower back.
Aiming to relieve and prevent future back pain, we recommended Socrates to perform some specific back exercises without forcing movement 2 to 3 times a week. Stretching his back regularly will provide more strength to his back muscles, improving Socrates' posture and increasing muscle support of his spine.